Welcome to the Animal Free Labcast, everybody. I'm back with Dr. Gemma Davis. Hiya, Gemma. How are you?
Hi, Carla. I'm really well, thank you. How are you?
Great, thank you. It's been a few weeks since we've been together doing an episode of the Labcast, so it's great to be back.
Yeah, it feels like a little while, doesn't it? But yeah, good to be back.
It does. What have we got coming up today?
So today we've got two very special guests. We're going to be joined by our Head of Science, Dr. Ross Doby, and also our Public Affairs Manager, Aaron Davidson. And they're going to be helping me answer some of the toughest questions that we've been asked by supporters and scientists.
I've been looking forward to this episode.
Yeah, because you're not on the spot.
Sorry, I have my evil laugh now, because I'm asking the questions, not answering them. So this is going to be a good one.
Yeah, hopefully.
So, before we get into that, though, we've got this new thing. We've got rid of the polls. We've said goodbye to the polls, and we're doing myth busting now. So, last episode, we asked, myth or fact, animal testing for medical research is required by law in the UK. I feel like I want to go myth or fact in a little jingle. So there you go, myth or fact, Gemma.
Yeah. So this one, it was actually a myth. So thank you to everyone who voted. And the vote was a bit split. So 70% of people voted that it was a myth. So 30% of people thought fact.
Well done.
So this is a myth, and well done to everyone who got that right. For a bit of background information, this was confirmed by the government in a written question back in 2023, where they said that there is no United Kingdom legislation that mandates animal testing. So whereas there is no law that specifically says that you have to do animal testing, there is law that says that where there is a scientifically acceptable alternative, it must be used. However, this is where we start to see the problems start, because there is no real kind of consensus on what counts as a scientifically acceptable alternative, for example, in situations like regulatory testing and drug development. So this means that in a lot of cases, animal tests are still used because they know that regulators will accept the data. So in the past couple of weeks, though, there has been a couple of developments to this, and this could be looking like it might change in future. So the MHRA, which is the Medicines and Healthcare Products Regulatory Agency, bit of a mouthful, published some new guidance to say that in some very specific areas, they will consider proposals for new drugs which haven't gone through animal testing. So this sounds like a really positive development. It is kind of in line with what we've seen from other countries like the USA, the EU and Australia, which have all previously approved clinical trials of biological therapies without the use of stranded preclinical animal data. So they've made it, now the MHRA have made it more clear where they do or where they don't expect to see animal testing. So it's good that that's been clarified. It's not a complete and saying we don't want any animal testing at all. But we are working through the guidance. We're, trying to establish exactly what this means. We're asking some more questions and getting a bit more information on it. So we can talk about this again in a future episode. But it does seem like a really positive step. So that's really good. But back to the original question. So well done to everyone who got this right, because this is really one of the main areas where people do get confused. Is this legally required or not? So it's something that we are working through, but it's good to know that it's not actually required by law. So well done, everyone, and thank you for voting.
Yeah, absolutely. And when Gemma says people get confused, I mean, this is a lot of people. MPs get confused about this. Scientists get confused about this. Pharma, regulators, a lot of people are confused about this. So
exactly. Yeah, it's really not clear. So good to have that question. It's written.
Good to have the question, and definitely good to see the MHRA that regulates the development of medicines and how they, can be used in the UK, actually starting to catch up with their US counterparts. So, step in the right direction. And as Gemma says, we'll talk about this another time once we've kind of figured a little bit more out about what's happening.
Yeah, exactly.
Okay, let's get on to the bit that I've been waiting for then. So, Aaron, Ross, welcome to the podcast. It's great to have you both back on.
Yeah, great to be back. Thanks for having me.
Great to be back on the podcast.
Good. Right. Okay. So I've got questions for each of you. For full disclosure to people listening, you have seen these in advance, so you have been able to prepare a little bit, but I might throw in the odd swerve ball just to see how you respond to those.
So
So
just being
these
mean
are,
today.
I know.
Enjoying
So
it too much.
So these are a mix of questions, some directly from our supporters. Some of them are kind of a mashup of the type of thing that we get asked quite a lot. And some of them are things that we might expect, a scientist to say. So Ross, I'm going to kick off with you. So let's pretend I'm a scientist. I've used animals throughout my entire research career and I've made really good progress. I don't want to change my methods. It's what I've always done. Why should I?
Okay, so that's an interesting question to start. And honestly, I think there's a couple of different ways that I could try and touch on to answer this. So first, I think it is important to highlight that under the Animal Scientific Procedures Act, if a scientist wants to use animals in research, then they have to justify it. They need to clearly show that the potential benefits of animal use outweigh any harm caused. And a big part of this process is asking, can this be done without animals? So something that Gemma touched on a little bit earlier. If the answer is yes, then using animals isn't justified and the license shouldn't be approved. This is what should be happening, but I think unfortunately the reality is a little different. And I know this is something that you've both covered in a previous podcast. So I don't know if you want to come in here and say a little.
We've talked about this quite a lot, haven't we, Gemma?
Yeah.
The rules say one thing and what happens in practice is something quite different.
Yeah, absolutely. It's something
Not
that
great.
we've seen through the work that I've done on the non-technical summaries that I've talked about before, which is the kind of official reports of the licenses that are submitted to the Home Office to apply for a license to use animals. And we do see this, people say, oh, I've used mice in my research for 17 years and this is a continuation of that work and things like that. But really, when you get into the detail of it, there are opportunities where those animals could be replaced with the modern technologies that we have now, and they should be. So that's something that we are really trying to work towards, tightening up that regulation to make sure that people do use what is available.
Because as you said before, Gemma, animals are not legally required. Use of alternatives is legally required. So we really need that to be actually happening. Okay, so Ross, going back to our imaginary scientist who doesn't want to stop ending animals, why should he or she?
Yeah, and I think it ties in really nicely to what Gemma just said there. So let's look at it from a different angle. So speaking as a scientist, at the end of the day, researchers are trying to design the best possible experiments to answer a question or to test a hypothesis. It's not about sticking to one method, it's about choosing the right method. And more, what we're seeing is that the right approach is often one that uses human cells, human tissue, and or human data. And I know I say this a lot, I certainly said it in the last podcast, but we have seen this huge advancement in human-focused research in the past 10, 15 years. And we have these countless examples of these approaches being used successfully to progress both biomedical research, so fundamental research, and also drug development. Now, I do understand that for a lot of researchers who have spent years or even their entire careers working with animals, switching approaches isn't easy. I mean, change in any context is hard. And a lot of this hesitation actually comes from or down to uncertainty. People just aren't always familiar with the alternatives or what they're capable of. But, luckily that is something that we can address. So one of the most effective ways to support a shift to human-specific research is by creating a space for scientists who have already adopted these methods to share their experiences, share their data, their insights, talk about what's worked, what hasn't. It's this kind of knowledge sharing that really helps others make informed decisions about where their own research can go. And this is something that we're actively working on at the Centre for Human-Specific Research, building communities to facilitate knowledge sharing and through promoting our human-specific pioneers, many of which have actually featured on the podcast already.
They have. Brilliant. All right. Thank you very much, Ross. I am going to change tack now and ask Gemma a question. So, Gemma, I've been prescribed a drug, but I don't want to take it because it's been tested on animals. How can I find an alternative that hasn't been?
Yeah, so this is a really common question that we get asked quite often. And the reason it's one of the tough questions isn't necessarily the answer. It's just that I don't like the answer I have to give. So, I'm sorry that, you might have been prescribed a medication, but unfortunately, there isn't a simple way to, look for an alternative that hasn't been tested on animals. It's not the same as, when you look at cosmetics and things like that and it's got a stamp saying cruelty free. It's a different situation completely. And pretty much every single drug that you are likely to be prescribed will have been tested on animals at the moment, because of the regulation in the UK and worldwide around drug development. I mentioned earlier that this could look a bit different in future. We've got new guidance from the MHRA, also from the FDA in the US and other parts of the world. They are, really thinking about how we can reduce animal use in drug development. So maybe if you ask me this question again in the future, I would be able to give you a different answer. But unfortunately, where we are at the moment, there is nothing you can do about this. If you've been prescribed a drug by your doctor, we would never say, don't take it. It would be absolutely, a conversation for you to have with your doctor. You should really listen to the advice that you're being given. And this really is out of your hands. The testing has already happened. And at the point where you're being prescribed it, it's really up to you whether you choose to take that. But you should always consult your doctor with any decisions you make. But, in my personal opinion, the best thing that you can really do is to take the drug and get yourself well and then use your renewed energy to do something about this in the future. Whether that is having a conversation with your MP, telling them your lived experience, telling them how this situation made you feel, and encouraging them to push and support for Herbie's Law and, making that change in that way. Or maybe if you're feeling up to it, you could do something like a fundraising challenge for Animal Free Research UK, if you could do a sponsored run or something like that. That will then help fund research into alternatives to animal testing, help us make progress with Herbie's Law so that in future this won't be an issue. So
Gemma,
that's kind of,
There are sometimes things that people can do though, aren't there? So sometimes, say if you're just taking like over the, just not, just off the shelf products, sorry, the ones that you don't get over the counter. Some formulations have got like a gelatine capsule, for example, or some of them are just. I always try to avoid. I definitely try to avoid the gelatine capsule ones. Like if there's an alternative, I'm vegan. I'm not going to have that one. I'm just going to have the standard little powder tablet. So there are some things that you can do, but they're pretty limited, aren't they?
Exactly, and you do have to be, quite vigilant with that really, because it can be the hard tablets but also the ones in the capsule. Both of those can contain things like gelatin, so if you are conscious of being a vegetarian or a vegan, that could be something that you can look out for. But again, if you talk to your doctor or your pharmacist about that, they might be able to find you a version of that tablet that doesn't contain an animal product. So that is one little choice that you can make and something that you can actively do. But in terms of the actual testing, safety testing and things like that on animals, unfortunately, at the moment, pretty much any medication will have been tested that way. Yeah. But we'll see in the future.
That's why
things are looking
we
positive.
exist. That's why we exist,
exactly.
to try and make that change. So thank you. Thanks, Gemma. Okay. Aaron, this question now comes from Deirdre and Paula on Facebook. So we've had a couple of questions about this. So the UK government has recently changed the Public Order Act to now make it a criminal offence to protest outside animal research facilities in the UK. What do you think about this development?
Thank you, Carla, and thank you for our supporters getting in touch. This, firstly, straight off the bat, we are troubled by this decision. It's not something that we're involved with. We're not involved with physical protest. Our work doesn't involve with physical protest. But I'm pretty safe to say that we're all troubled by this decision, and it goes against the government's recent strategy and the manifesto commitment to work towards phasing out. We would much rather them talk about the work that they are doing and work that we want them to do further to do this, instead of taking this backwards step. And the disappointed defence within this change also runs contrary to public opinion and scientific evidence for phasing out testing. We're focused on the future. We're focused on Herbie's Law. We're focused on campaigning for that positive solution. But like I said, it's not something we focus on specifically, but it is a disappointing turn, definitely.
And I think the justification is the thing that's, really kind of riled people as well. Like, these labs have been designated key national infrastructure. So what do you make of that, Aaron? Why is the government making labs key national infrastructure at the same time as saying that it wants to phase out animal testing.
No, I also feel like the government on a personal level hasn't actually laid the justification for this change. And the way they went about this change was not the most appropriate manner for a change of this manner. So they decided to use a more arcane route of a statutory instrument to make this quite big change, which will have quite a big of an impact. But no, I just think that what they should be focusing on is investing on the alternatives and really driving forward that solution instead of trying to criminalize people protesting outside of facilities.
Okay. Good answer. All right, I'm going to stay with you, Aaron. Herbie's Law. Another tough one.
Ready for it. Better loosen up for the next one.
Okay. Herbie's Law, as we've talked about lots of times on this podcast, calls for a phase out of animal testing by 2035. That's still 9 years away. So why are you not demanding, or why are we not demanding an immediate end to animal testing? And we get asked this one quite a bit.
Yeah, no, this is something that we do get asked a lot, and I'm sure that everybody, myself included, listening to this podcast would love to phase out animal testing tomorrow, end it tomorrow, not phase it, end it tomorrow. But in reality, we need to bring everybody with us on this journey. We're making so much progress with politicians, scientists, industry at the moment. On the political side, it's really fantastic news. We've got 170 MPs and peers who now support Herbie's Law at Parliament. You know, it's really great. It's really fantastic news, and it's over sort of like 20% MPs who now support Herbie's Law. And on the APPG, which we support and run, which is the APPG on phasing out animal testing in medical experiments, the medical research, APPG that we support there has now got 49 members, which is really great. So we are making huge strides forward on the political side, on the scientist side, and on the industrial side. But what we need to do is to set that long-term goal for everybody to work towards. So the business of certainty and the regulators of certainty, and that politicians and scientists of certainty as well, that the future is truly animal free. But yeah, I just want to say that we are making huge progress. It's all about bringing everybody together. I personally want it to end tomorrow. I'm sure everybody listening wants it to end tomorrow, but we need to bring everybody together and provide that real certainty that a 9-year now deadline has.
I think what I would add to that, as somebody that's been kind of working in this field for quite a number of years now, and I know that some of our listeners and supporters will have been around for a lot longer than I have, but my years stuck up to about 18 years of trying to create change for animals in laboratories and trying to end it. If calling for an immediate end to animal testing was going to work, it would have worked 120 years ago when this campaign started. And it hasn't. We're not there yet. And that is because it's so complex, and it's really messy. And it's heartbreaking that it doesn't work. I really want it to, I don't want it to end tomorrow. I want it to have ended 120 years ago. Like, this should never have been allowed to get this far, but it has for a whole complex kind of mashup of reasons. And what we need to do now is bring people on board and take them on the journey, like you say, Aaron. And realistically, that is going to take some time. We are making progress now. We have more people on board with this message than ever before. It's absolutely snowballing. So I really believe that although it is heartbreaking and horrific to think about the animals who are suffering, and it's even worse for them, of course, that this is the way to go to actually create change for them. Sadly, this seems to be the thing that works. Okay, let's pivot. Ross, back to you. This is a question for Bernard via the podcast poll comment box. Bernard, I love this question. Thank you so much. Right. How much is AI, computers, databases, and cross-referencing going to contribute in advancing scientific research? Is it possible that this combination of advanced scientific tools, along with new biological methods, could eliminate the exploitation of other animals in scientific research?
Great question. I think this is such a hot topic at the moment. I think for me, what's really exciting is we're not talking about tomorrow's world anymore. AI is already being used by many in the scientific community to really good effect. I mean, right now there are companies putting AI at the heart of their drug discovery programs, and this is reducing their reliance on animal studies. So if I can give just one example of how scientists are using AI. So AI is really good at identifying trends and patterns across huge scientific data sets. much, much better and more efficient than humans. So this involves analysing millions, if not billions of data points, which AI can do relatively easily. Now, trained with all this information, we can then use AI to predict whether a new drug will be safe and effective before it's ever tested in animals. At the moment, this is really helping to reduce animal studies, but it's not a full replacement yet. Now, where I see a real potential in being able to replace animal testing altogether is when we start using AI in combination with other non-animal approaches, such as 3D cell models. When you start using these approaches together, when you start thinking of them as part of this human-specific toolbox, using the strength of each to answer a specific question, then that's where we'll start to see big impact in replacing animal studies. And it's this bringing together of these communities. So you've got the computational scientists working in AI, wet lab scientists developing cellular models. It's a big part of what we want to do at the centre. There's so much these disciplines can learn from each other. And when you start collaborating, that's when real momentum builds.
I really think that AI could be the thing that actually is the difference that makes the difference here. And maybe it will get us there before, our 9-year deadline is up because, of the potential to kind of understand all this data and start to make, good predictions from it. But, there are concerns around AI as well, aren't they, just more generally? So is this something that the scientific community are engaged in? I'm thinking about, AI doesn't always get it right. That could be quite bad for patients, couldn't it? There's an environmental impact of using AI. There's concerns around the singularity, at what point does AI start, taking over the world? Are these kind of live conversations in the scientific community?
Yeah, they are, and they're big questions, and we need to definitely consider them, and they are being had. I think the interesting one you mentioned about AI getting it right, and I think when you talk about that, it's important to mention that AI models are a lot like us. They need to be fed, and just like humans, what you feed into them makes all the difference. The quality of data going in, so the quality of data being fed in, that directly shapes the quality of what comes out. If you're working with poor data, you're going to get poor results. I mean, it's the equivalent of asking an athlete to smash their personal best living off nachos and Iron Brew. And you could probably tell that I'm Scottish there because I said Iron Brew. So if we actually want AI to deliver...
That was the tell, Ross, yes.
That was the tell. So if you want AI to actually deliver really relevant, impactful results, then you've got to start with the inputs. You've got to make sure they're solid. You've got to make sure that they're reliable. And importantly, they've got to be human data.
Yeah, I think it's a really interesting area that a lot of the companies that are starting to use AI, they're kind of keeping their own data in their own AIs. And there's going to be a lot of conversations that will need to be had in the future about, how do we make one big AI that can really drive, the more data that can be put into an AI, the more intelligent it is, the better it is, the more reliable it's going to be. But like Ross says as well, it needs to be human data. So a lot of companies are just using their historic animal data to train an AI. And then you've got to still work out how to translate that into a human. So there is going to be a bit of a transition period even within this new technology before it's going to be ready. But it really does seem like it's going to be the future. Like Ross said, it's going to make everything faster, more reliable, automated. And that's how we can then start to look at things like personalized medicine, because everything's going to be so much quicker and we can compare and make connections and patterns. So yeah, it's very exciting stuff, but also
exciting.
A little bit scary. Hopefully it won't take over the world. That's my fear.
Interesting. It is interesting what you sort of mentioned. You talked about the singularity. You talked about the impact on climate. And to be honest, they weren't things that I'd thought about too much. And it's so easy to get caught up in what the positive side of things. It's having such a positive impact on scientific research, and it's helping to replace animals. But you're right to raise these points, and they can't be overlooked. And I think it's important that they're carefully considered along with the sort of natural progression of AI.
Absolutely, and that's a wider governance kind of issue, isn't it? For for AI, and those conversations are happening, and I'm sure scientists are involved in those. And I know we're organising a conference to take place next year, and we want AI and in silico to be a big part of that. So there's sorts of conversations that we'd be having at our conference with our community as well, aren't they?
Absolutely.
All right, Aaron. back to you. A final question. So this is actually Gemma's question, but I'm going to ask it because I am the questioner. So Gemma says, my MP isn't interested in animal testing and has even stopped replying to my emails about it. Shocking, right? Is there any point in me sending the emails that you ask me to? Are they even reading them?
I've got a nice one-word answer for this one, nice and short answer. And
Great.
persistence. Now, I know what it's like. You email your MP and sometimes you feel like you don't feel like you're not being heard. Now, MPs are getting sometimes up to hundreds of emails a day on all different issues, especially with all the international stuff going on, and might be some local issues as well. So the key thing is to try and stand out from the crowd. So when you're sending emails, and obviously we provide actions that you can take part in on the website and through social media, but also follow up with your own individual emails after that. So wait a few weeks and follow up. You can also call the MP's office. The telephone numbers on the website to follow it up. Another thing you can do as well is that MPs often have meetings in their area. They're called surgery. It's a bit like a GP. They will have a surgery appointment. And you can get in touch with your MP and you could ask for a meeting at their local surgery. You don't have to say what your reason is. You can just ask for a meeting, or you can say it's to discuss this issue. But I'd really encourage you to do that and to ask to meet with your MP. And if you are going to do that, please do get in touch with us. We're more than happy to help in providing briefings and sort of talking you through how the process works that way. But I would encourage anybody who's listening to this, which I hope is in the thousands of people, including myself, just to keep on going, because I know what it's like. I've been on there where you feel like you're emailing forever, but sometimes it is just about continuously keeping up the pressure. They do read them. They do read it on their phones sometimes in the chamber, as you might have seen, or they'll read it on their emails when they're catching up. MPs will do read it, but they are getting lots of correspondence. So please do keep up the good work, because it makes all the difference. Just one other final plug before I finish off. So we're actually on Tuesday, the 21st of April, we're holding a drop-in session in Parliament, which is going to be, it's sponsored by Steve Race, who's the MP who is behind the Herbie's Law Prime Members Bill. And we're holding a drop-in event in the Thames Room in the afternoon, which is going to be a fantastic event for MPs to come and meet with us, chat to our expert scientists about what further steps they can do to support Herbie's Law in Parliament to really help us to get that to that 200 MP number that we're aiming for. So we're at 170. We want to keep on going, but we've got the event next week. So please do jump up onto our socials and on our website. And there's a nice, easy action you can take, and you could get in touch with your MP and just keep up the volume to really show that this matters to you and that then it's take further actions on this.
Yeah, it makes such a difference, doesn't it? Thank you, Aaron.
Thank you, Aaron, for
Okay.
answering my question. And I have invited my MP to the event, so we'll see if she comes.
Thank you, Gemma. And remember,
Fingers crossed.
persistence. Persistence
Yes,
is the
I
word
will
of
be persistent,
2026,
yes.
everybody.
Thank you, Aaron. All right.
So I've got a question for you, actually, Carla. I'm turning the tables.
Oh, okay.
Just a very quick one, because this is
Yeah.
a good question. So you might have seen kind of people talking about this recently, but what about the millions of animals that are used for meat every year? That number of animals used for meat massively outweighs the number of animals used in research. So are we focusing on the wrong thing?
Oh, what a great question. Okay. I think what I would say on this is that we all have our own kind of politics around animals, don't we? So not everyone who supports an end to animal research would be vegetarian or vegan. I am. I'm really open about that. So I care about all animals. I don't want animals to be suffering or being killed for meat or for dairy or for being used in research. But Animal Free Research UK is a charity. And as a charity, we have, we're governed by the Charity Commission, and we have this very specific kind of mission. And our mission is to expose and to try and work to end the use of animals in research, really specifically. I don't think it's helpful to think about a hierarchy of suffering of animals. I just think it's about different things. There are great charities and great organisations working to end the use of animals or to improve conditions for farmed animals. And that's brilliant. And if that's what you're interested in, great, go and interact with them. And, I'm sure they're doing all sorts of great campaigning things that you can do where you can lobby your MP and all the rest of that. And that's really important. work if that's something that you're interested in. But what we're specifically set up to do at Animal Free Research UK is to highlight the alternatives that can be used instead of animals in medical research. And that's what our skill set is built around. That's why we have brilliant scientists like Gemma and Ross on our team. That's why we have public affairs experts like Aaron on the team. And, it's a real single focus for us. That's what we're aiming to do. And I think we're being increasingly successful because we're so tunnel vision on that.
Yeah, absolutely agree. It's not one or the other. All the animals matter. It's just, especially when we're talking about medical research, it's what's the best science, really. And we know that animal research isn't the best way to find answers for humans. So excellent answer. Thank you, Carla.
You're welcome. Well, thank you, all of you, Aaron, Gemma, Ross, and thank you for your questions, everybody at home. I know we didn't get to all of them, but I hope that we did a good job for you. And do let us know if there's anything else that you'd like to know, and we can cover that off in a different episode. Well, that's all we have time for in this episode, but Gemma and I will be back in a fortnight when we'll be joined by Professor Mirella Delibegovic and Dr. Sarah Camley Salino. They're from the University of Aberdeen, and they're going to be telling us all about their work using human-specific approaches to study diabetic kidney disease. Before we go, though, Gemma, this week's myth or fact. What have we got?
So this week's question is, there are important scientific questions that can only be answered through animal research, myth or fact. So you can vote on our website, and you can find the link in our podcast email that comes out on a Thursday, or the links on our social media, and we'll discuss the results in the next episode. So thank you to everyone who took the time to vote last time, and also to send in a tough question. And like you said, Carla, sorry we didn't manage to get through all of the questions. But if you do have any other questions, or you'd like to get in touch about anything else, please do drop us an email at hello@animalfreeresearchuk.org, and we might feature your comment in a future episode.
Well, thank you so much for joining us, everybody at home. Thank you, Gemma. Thank you, Aaron. Thank you, Ross. And we'll see you next time. Bye.
Bye.